Did you know 17 to 20% of Filipino adults have mental health problems? And 10 to 15% of children too? No? Well, I'm not surprised. This is because lack of awareness is one of the factors that contribute to these problems alongside genetic disorders. But these aren't the only factors. Exposure and experiences of a person are too. Here in the Philippines, mental illness is actually the third most common disease, and we rank first with the highest number of depressed people in Southeast Asia. The country still greatly neglects the existence of mental health concerns, which is proven by the government only allocating 5% of their budget for it. And even if the Department of Health launched Hopeline in 2016, a lot of people say that it is very inefficient and unreliable. This is why Identity was born. It is an apparel brand that raises awareness for mental health through the use of statement tees and brand advertisements, whose designs would be done through the use of light-hearted vector graphics. These tees would cost no more than 500 pesos, which would be possible through a partnership with a clothing producer. The advertisements would showcase models that are affected with mental health concerns. Identity aims to reach out to all genders of the older half of Generation Z and NCR, or specifically those born within 1995 and 2003. Based on research, this generation is the most affected by mental health problems. They are referred to as children born at the turn of the century. And out of all the generations that have passed, Generation Z is able to make big changes in the digital age as they utilize the internet very well and stay online 24/7. They are also very entrepreneurial. Statistics show that although 77% of Filipinos do have a brand preference, 78 of these people are willing to try out a new brand. But we should also be cautious of the effects of fashion, as fast fashion can harm the environment with the use of different chemicals and may also kill animals in effect. On the good side, a lot of retailers are already transferring to sustainable fashion, which ensures customers that their clothing is manufactured, marketed, and used in the most sustainable manner possible. Republic Act 11036, or the Mental Health Law of the Philippines, was also recently passed, which covers the rights and welfare of those with mental health needs and equips the government with psychiatric, psychosocial, and neurologic services. Moving on, how is identity going to be possible? After making vector graphics, vinyl printing will be used to print the designs onto the fabric itself. Fashion shoots would be done for the advertisements, and video interviews would be conducted as a way to inform the public about it. These ads would then be posted on social media networks to be able to reach out to more people. Linya Linya and Artwork are both t-shirt brands that make illustrations as their prints, which is why they are possible rivals for Identity. For suppliers, possible ones would be Genevieve Gozzo, Transfer It, and RT's t-shirt printing. Identity's graphics would be inspired by the works of Brad Flaherty and George Lahuerta, while the photography style would be inspired by Javier Ruiz. So, what now? Based on the survey made, 95.9% answered yes to purchasing a tea that would raise awareness for mental health. Most of them answered that it would actually draw the attention of people, which would then make a difference and help spread awareness for mental health. In conclusion, with the brand solely dedicating to raising awareness for mental health, it enables its wearers to feel more empowered, as these shirts serve as an avenue to express their feelings, as fashion is a symbolic communicator. Having said these things, people who would be seeing all those advertisements on social media and the people wearing it would then understand further and become more aware of the real existence of mental health concerns. As Senator Risa Hontiveros said, "No longer shall Filipinos suffer silently in the dark. The people's mental health issues will now cease to be seen as an invisible sickness spoken only in whispers."